This is part 4 of a COVID-19 infection control training module. A COVID-19 healthcare WHO standard-based module produced by Debonair Training. Specially designed for medical doctors and nurses, laboratory technicians, cleaning, delivery, care homes and personal home care. You can use the bottom play bar to control the slides and navigation through this module if you get stuck on any slide. Alternatively, use the next highlighted table of content menu on the left. Note: this training module is best viewed with a laptop or desktop screen size, while it can be viewed with a mobile device. For the best mobile learning experience, please download our mobile app. This is where most infections enter our hospital. People come in and out of the reception area every day, even if only one of them has an infection. If you don't take the right precautions, it could spread to everyone else. There are a few things wrong here. You may have noticed them. These will just have to be fixed, especially now we have a coronavirus, COVID-19 pandemic, to deal with. Now let me introduce myself. My name is Adesuwa, and I am an expert in hospital reception hygiene. I have been sent here to deliver critical compulsory training for all healthcare workers in this facility. There is no room for errors here, so your full unhindered attention is required. Click the forward arrow to decide the way you want to proceed through the rest of the course. What do you have to do here to reduce the COVID-19 infection risk to flatten the curve? Select one or more options below and click Submit. Brilliant. Correct answer. Press or type the key Y on your keyboard to continue. Social distancing of at least 2 meters from people not members of your household, the same length of a normal adult bed or house door, along with thorough frequent hand washing. Hand washing, for a minimum of 20 seconds, upon contact with outside objects, long enough to sing Happy Birthday song twice. Click the forward arrow to continue. Now, assess the individuals who are not following guidelines to stop the COVID-19 pandemic. Click on the patients to remove them from the area, then click Submit. Brilliant. Correct answer. Press or type the key Y on your keyboard to continue. Social distancing of at least 2 meters from people not members of your household must be maintained with all incoming patients. Touching of the face with one's own hands should also be discouraged. Click the forward arrow to continue. Which of these 3 guidelines will you use for creating posters for use in the healthcare facility? Select one or more options, then click Submit. Brilliant. Correct answer. Press or type the key Y on your keyboard to continue. You are grasping the principles of infection control. Click the forward arrow to proceed. You are at the reception desk and notice a boy has been far too quick going to the restroom. It's clear he hasn't washed and dried his hands. What should you do? Select one of the options below and click Submit. Absolutely right. You must not let the boy go back into the waiting area. Immediately ask him to do a more thorough wash with soap and water. Remind him to sing the Happy Birthday song twice while washing. Click the forward arrow to continue. When we clean the floors in the hospital, what process should we follow? Select from drop-down in the correct order and click Submit. Wrong answer. Press or type the key Y on your keyboard to continue. Look at our guidelines, then try again. Click the forward arrow to go to the relevant Learn It section. Use the drop-down to arrange in the correct sequence for wearing PPE. Then click Submit. Wrong answer. Press or type the key Y on your keyboard to continue. Which of these is not a reason to wear homemade masks? Then click Submit. Sorry, you must answer this question to continue. Brilliant. Correct answer. Press or type the key Y on your keyboard to continue. This is your result for the COVID-19 infection control pandemic. This assessment is very similar to a driving test, because if you haven't passed it, it simply means you are high risk to yourself and to the others you work with, so please study the Learn It, Part 2 and 3 of COVID-19 training module. Then retake this test, to get current accreditation to work in a high-quality infection facility to save lives. Click the forward arrow to continue. You've dealt with all the infection risks. Everything you've learned in this course also applies to any reception area. Ensure visitors follow the principles of good hand hygiene. Are practicing social distancing in the waiting room. Make sure all objects and floors are cleaned in accordance with guidelines. Special mention for reference: WHO, NCDC, Artists Assets and Adobe Captivate data on COVID-19, whose material has been researched and referenced in this production. Click the forward arrow when you're ready to continue. If you're viewing this infection control simulation via Debonair YouTube channel, you can interact directly with the online training module by clicking on the link in the YouTube video description. For more incisive training slides, to expedite the end of this global pandemic, and to minimize the damage to our health and economy, you may contact Debonair Training Limited using the following details. Click Close to exit or use the bottom play bar to go through the Learn It sections again if you want.